Hello everybody, this video is about the suggested correlations between COVID-19 infection and vitamin D level. First, the outbreak occurred in winter time when the vitamin D level is lowest. This is the same situation with other seasonal influenza infections. Second, the infection was more severe and spreading quickly in northern hemisphere as there is little ultraviolet rays and little vitamin D formation. We can notice also, for example, at northern Italy and Wuhan district in China have lower ultraviolet sunlight per year than other areas in their countries. Also, the area hit hard in China has high air pollution, which lower vitamin D production. Other important correlation is that the infection hit badly the elderly group who are known to have lower vitamin D. Also, the fatality was recorded more in Afro-American population. Example, in Chicago, an estimated 72% fatality in Black people who constitute only 30% of the population. As we know, black skin needs more time in the sun to synthesize vitamin D. Australia has been doing relatively good with its sunny environment. This paper was published April 2 in Nutrients, which analyzed these correlations. It says that vitamin D supplementation could reduce the risk of infection by COVID-19 and its complications. The paper recommends that people at higher risk of influenza or COVID-19 infection should consider taking 10,000 international units of vitamin D daily for a few weeks to quickly elevate vitamin D level, then maintain on 5,000 international units per day. Target to reach 40 to 60 nanogram per milliliter vitamin D blood level. In US, the former chief of Center for Disease Control said that coronavirus risk could be reduced by vitamin D. Also in the UK, the government advised people to take vitamin D. Actually, in the last decade, vitamin D deficiency was recognized as a pandemic affecting more than 1 billion persons throughout the world. One of the main causes of this is lack of knowledge that sun exposure in moderation is the major source of vitamin D for most humans. Other causes include indoor living, like in elderly people. Actually, elderly people have many causes of vitamin D deficiency. First, they stay more time indoor. Second, their skin has less ability for production of vitamin D. Thirdly, they took many medication and some of them may contradict vitamin D availability. Another cause of vitamin D deficiency is dark skin color, dark climates, pollution, obesity, excessive use of sunscreens. Vitamin D or cholecalciferol is a corticosteroid hormone which is not only important for bone health but is also important for many diseases including infections, autoimmune diseases, common cancers, and cardiovascular diseases. And many observational studies were correlating its deficiency with these diseases. Vitamin D importance has been changed dramatically over the last decade because of two main reasons. Number one, that vitamin D receptors were found to be present in almost all human cells. The second important reason is the finding that the enzyme responsible for activation of vitamin D, 1-alpha hydroxylase, is not only present in the kidney as known before, but it's also expressed in many cell types, including the immune cells. The immune cells, by having this hydroxylase enzyme, can convert the inactive circulating form of 25-hydroxyvitamin D into the active hormone, which then can be used in an autocrine or paracrine matter. In the immune cells, this active vitamin D is not under the control of systemic feedback mechanisms. So immune cells can produce high level of concentration of active vitamin D needed for immunoregulation away from the systemic feedback mechanism. Vitamin D receptor is a member of the nuclear receptor family of transcription factors that regulates the expression of more than 900 genes. How vitamin D works? In general, no clear functions of vitamin D, as the immune response is not static and depends on the stage of infection. How vitamin D works as an antiviral agent? Number one, by induction of cathelicidin and defensins, which are peptides that works as antimicrobial agents that can lower viral replication rates. Number two, by making a shift between the balance of T helper 1 to T helper 2 with the benefit towards T helper 2, so vitamin D can decrease the production of pro-inflammatory T helper 1 cytokines such as tumor necrosis factor alpha and interferon gamma. And these pro-inflammatory cytokines could be responsible for the cytokine storm, which is proposed as one of the mechanisms of lung injury and respiratory tract infection by COVID-19. Thirdly, vitamin D has an increase the anti-inflammatory cytokines by the macrophages. Other suggested mechanism for vitamin D is that vitamin D can reduce the incidence of many chronic diseases like cancers, cardiovascular, diabetes, respiratory tract infection, and hypertension. And it's known that patients with these chronic diseases have a significantly higher risk of respiratory tract infections and complications with COVID-19 infections. Also, some researchers showed that vitamin D could restore barrier functions of epithelial cells, which has a beneficial effects during tissue inflammation. Again, another suggested mechanism is that vitamin D works as a potent antioxidant that normalize mitochondrial activities, preventing oxidative stress, lipid peroxidation, and DNA damage. As a conclusion, there is a strong rational background for vitamin D supplementation as a prophylaxis from COVID-19 infection.